My name is Cynthia Hetzko, and in August of 2016 I was diagnosed with breast cancer. It was my second cancer diagnosis, and I was still undergoing treatment and follow-up for my first cancer. So it was sort of an overwhelming kick in the stomach when I learned that I had a second diagnosis. Luckily, I was being treated by a wonderful team of providers who led me straight to PRMA. And that's where I met Dr. Chrysopoulo, and that's where I started on my journey, which has been really, for me, an easy journey and a very happy journey, because I am very pleased with the outcome of my surgeries. I had a mastectomy of my left breast, and Dr. Chrysopoulo performed a reconstruction at the same time that the mastectomy was performed. So I went to sleep with a breast and I woke up with a breast. So I didn't lose anything. Well, I knew right away that I wanted my own tissue. I did not want implants. It's just a personal thing. So I knew right away that when I was talking with Dr. Chrysopoulo, he first was talking about the tummy tuck thing. And because I'd had so many abdominal surgeries with my first cancer, there was a good possibility that there wasn't enough viable tissue on my abdomen to use that tissue. So Dr. Chrysopoulo did some diagnostic investigation to see if I had adequate blood flow in order to use some of my tummy tissue for my reconstruction. But it was found that I did not. And he said, you know, we could take a chance, but he said, I don't want to take a chance, because it's possible that you don't have good blood flow and you would not have a positive success with this reconstruction. So the next option for me was my latissimus dorsi muscle, which is the muscle of the back. And I chose that because, again, I said I did not want anything but my own tissue. The only thing that I found that was different about it was, of course, I did have a large scar that went around my back, but it's right at the level of my bra line. And really, after healing, you can't even really tell that I have a scar there. The other thing that's very interesting about having this type of reconstruction is that I opted for Dr. Chrysopoulo to not cut the nerve, so that I do have feeling in this breast, but I also have muscle movement. So it's interesting sometimes when I move my arm that I feel muscle contraction in my breast. But it isn't anything like my breast leaps out or anything. It's just a very fine little movement that I feel. I don't have any strength deficit. I don't have any difficulties with any of my movements at all. I am very pleased with the outcome of my surgeries, and I am very thankful that I was sent to Dr. Chrysopoulo, and his team was wonderful. My second surgery was to reduce my other breast so that it matched my new breast. And I must say that at this point in my life, I couldn't be happier with the results. You are in such good hands. I would also tell you that the surgery itself is really not a difficult process. It's so wonderful to wake up after a mastectomy and have a breast. Why wait? Why wait after a mastectomy to get a new breast? It's so much easier. You only have to go through that surgery one time, and it's just a wonderful feeling to know that really your body, even though it's changed inside, outwardly, you can't tell.